we learned how to smoke more. Earlier, a person probably did not smoke as much because you all that in the panchayat, the village elders would sit and do some gurgur or a hookah. But then, about the 60s, look at Time and Newsweek magazine. What were the ads? The coolest dude was this guy wearing a hat on a horse. And it was, the cool dude, the Marlboro County man, right? So he was the Marlboro cigarette man. And all this reflected, Rajinikanth, all those fancy things which he would do, flick a cigarette. What is the impact on society? Look at a child, look at the peer pressure that he has. He took to smoking. And look at our occupational stresses. My parents often complain, you don't have time to sit with us. And I keep telling them, parents, you realize that there are no soft jobs any longer. I go back to the time I was a child. My dad would work from 9 to 5. He would return home by 5:30. And if the kids are playing and making a noise, my mother would say, hush, don't make a noise. Your dad is tired. He's coming back so late. Look at it today. We start work at 7:30. We come back home at 11. Whether you have a microwave dinner or you don't have a microwave dinner, there are phone calls coming, and this is with everybody. So there are no soft jobs any longer. Plus, we have started keeping people alive for longer. We have in cardiology, we have angioplasty, we have surgery. We have also understood that intensive care, once it is improved, we can address a lot of issues. So this has led to increased life expectancy. It has led to substantial increase in healthcare costs. But it has also led to, rightfully, every human being deserves the best healthcare that is possible. But can a community afford it? Actually, not curative. What a community can afford is preventive healthcare. And that is what, because it is inexpensive. It is inexpensive to think of changing your diet. It is inexpensive of going out for a walk or going for a run. It is inexpensive to think of being cool and sharp. But today, what is happening is we have less activity, higher calorie, we are all couch potatoes. And remember, this world is not one that we have inherited from our parents. Think of this earth, planet Earth, as something we have borrowed from our children. And lifestyle, even if our parents had some bad lifestyle, we chose the softer and the worst form of lifestyle. Our kids are going to do the same with us. So, if you look at this, cardiovascular disease increased from pestilence and famine from 10%, 20% preceding pandemics, and 40% in degenerative disease, and now it is becoming more and more. So this speed of transition is different in the developed and the developing world. The developing world is facing the worst because there is a rapid transition. In 2 generations, from a bajre ki roti, we have gone to either a chana bhatura or we have gone to a Domino's pizza or a Mac burger or whatever it is. Western models are excellent, but the 21st century actually belongs to the Indian. We need to awaken. We need knowledge, we need attitude, and we need practice. K-A-P. My wife is here, so she'll wonder he's gone about it again. My most favorite quote from Hindi literature are 3 lines from Jaishankar Prasad in the book Kamayani. In Kamayani, Shraddha leads Manu, after he has seen urban life, she leads him back to the hills. And she says to him, they see 3 peaks in the distance. And she says to him, Yahi Tripur hai. Yahi Tripur hai, dekha tumne? 3 bindu, jo tirmay itne, gyan, knowledge, dur. कुछ क्रिया भिन्न है, इच्छा क्यों पूरी हो मन की, एक दूसरे से न मिल सके, यही विडंबना है जीवन की. And how appropriate. We all know what I'm going to say in the next 15-20 minutes. But how many of us practice it? When we see a nice gulab jamun or a nice samosa, well, it is like I had a boss once who said, He was a very fine gentleman. He was a practicing radiologist, one of the senior most radiologists we had in the armed forces. He's no more, may God bless his soul. But he gave me a wonderful quote. I can resist anything but temptation. So that is how we are. We are 1/6 of the world population. Still 2/3 to 3/4 in the rural areas. We don't have data from India. Our diets are traditionally rich in cereals, which are carbohydrates, and bad fats, which is your hydrogenated vegetable oils, which are made to look like ghee, which are things like dalda and rath, which are put by the halwai every morning. Is a oi damru lekara, isme dal, and then he keeps frying the whole day, which generate trans fats, and trans fats are like time bombs. We are metabolically challenged. Genetically, an ethnic Indian male is at the highest risk of atherosclerosis and coronary artery disease wherever he lives in the world. We have those bad genes. What do? We have so many pluses. We have great culture. We also have agriculture. But we have very bad genetic background. You look at Indians, whether they are in America, Scotland, anywhere in the world, they are at the highest risk. So what do we do? Why now? Why is the time to get active now? Because what we do today will have an accumulated effect on all our tomorrows. This is what I explained to you. That is how fat gets deposited. And this is oxidized fat, especially coming from trans fats, gets deposited inside the arteries. This is like a gruel. That is why athero. And it hardens the artery, that is sclerosis. So this is atherosclerosis. And when this plaque, we call it a plaque, it looks like, have you all seen a single fried egg? It is like a single fried egg being wrapped inside a tube. And if this single fried egg, what happens if you touch maybe a fork, or maybe you take a toothpick to the single fried egg, it kind of bursts. And what happens is, over a period of time, it solidifies further, right? So what happens is, this single fried egg is metabolically active and hot. It is like a volcano. Now if you touch it, or any injury, what is the injury? Cigarette smoke, stress, all these injuries can burst this plaque, what is called complicate this plaque, and cause a clot to be formed. And this clot results in a heart attack. And heart attack, because these arteries, when they get blocked, suddenly they kill the tissue where they supply. Now, what are the risk factors? We've been discussing risk factors. Traditionally, we define risk factors as A, what you cannot modify. What can't you modify? You can't modify your age. Of course, ladies ke liye applicable nahi hai. They never get older. All of us get older every birthday. But you cannot modify your age. I know you will say that some people can modify their gender. But most people can't modify their gender. And the female gender in the reproductive age group is protected unless they take oral contraceptives, unless if they are diabetic, or if they are hypertensive, then they lose the protection. So sometimes, we make mistakes because we think a 36-year-old lady can't have a heart attack. But you don't know what this lady has. She can be on OCPs, she can be diabetic, she can be hypertensive, and she could be smoking. Because it's not uncommon, incidentally, female smoking incidence is rising 3 times as much as male smoking incidence in India. So, this is something which ordinarily we say age, gender and family history. Some families, unfortunately, have a high amount of genetic form of coronary artery disease. We don't know we haven't unraveled the entire mystery. But we know that if somebody's grandfather has had a heart attack at 40, the father has had a heart attack at 40, 45, we know that the son will also likely to have a heart attack earlier. And the fourth is, I would put being Indian. Being Indian puts it as high risk. So let us take these 4 things which you cannot modify. What can you modify? You can avoid smoking. If you are diabetic, how many people here know their blood sugars? or have had their blood sugar tested? Please raise your hand. Dada, how many people have never had their blood sugar tested? Raise their hand. Oh, there are people. Being an Indian, everybody should have a blood sugar test. Having better control of diabetes. How many people here have never had their blood pressure recorded? आपने अपना blood pressure record कराया है? आपने सर?
मैंने?
हाँ जी.
मैं तो हर रोज रिकॉर्ड करता हूँ.
आपने आपके पीछे?
आप अभी ना सर?
हाँ जी. कभी blood pressure आपने नपवाया है?
Yes sir. चलिए.
नपवाया. Very good. Because we will realize why it is important, because we don't know how many people honestly here have smoked ever or never, or anybody who has ever smoked, please raise their hand. Or there are a lot of people, and actually incidence is much more. How many people here know their ideal body weight? Ideal body weight. And how many people are above ideal body weight? Can you raise your hands? There are lots of them. I know that it will not happen. So we need to know that smoking, control of diabetes, control of blood pressure, control of lipids, the appropriate cholesterol, and control of obesity are things which we can modify as well as physical activity. How many people here go for a walk every morning? Very good. How many don't go for a walk? Honest. Some more. Little more honesty.
Doctor, so what are lipids? What are lipids? Please explain.
I will explain. I will come one by one. Now, hypertension is high blood pressure. It has nothing to do with mental tension. हमारे पास मरीज लेकर आते हैं, बोलते हैं जी इसको घर में बड़ी टेंशन चल रही है, इसको चेक कर लो. But it has got nothing to do with mental tension. Who has high blood pressure? Who does not have high blood pressure? We don't know. But we know that those who have high blood pressure have reduced lives, reduced lifespan. And they have a lot of consequences. They can have brain strokes, they can have kidney failure, they can have heart disease, they can have aortic dilatation of the aorta or other vessels because of high blood pressure. Now, high blood pressure is not a disease of the right arm or the left arm. High blood pressure is a disease wherein the pressure in the arteries is higher than what is normal for age. And as time has gone by, we have started treating lower and lower blood pressure because we have realized that when we treat it, we get longer lives, we get less strokes, we get less heart disease, we get less peripheral vascular disease. So we get all this, we get less kidney failure. When I wrote my MD dissertation, I was looking around I did a very extensive study, did a lot of detailed analysis, and I was looking to understand it. I couldn't understand many things. So I found a book and I found a quote. It says, hypertension research is like the man who lost his keys in a poorly lit car park. A passing stranger came by and offered to help. He looked around for some time, idhar hai. After some time he says, "Sir, are you sure you lost your keys in this part of the car park?" This man says, "No, I'm not really sure I lost my keys here." He said, "Then why are you looking here?" He said, "Because the light is brightest here." So that is how we are actually looking at high blood pressure. But just look, we have by 2025, we are likely to have 30% of our population having high blood pressure. 1.6 billion are likely to be high blood pressure, and 75% in developing countries. This trend as with age is increasing. Hypertension is a silent killer. It has no symptoms. It's only in Bollywood that high blood pressure means kanpatti garam ho gayi ya gussa aa gaya. अरे जी इनको गुस्सा बहुत आता है, इनका ब्लड प्रेशर चेक करो. Actually उनको गुस्सा आता है इसलिए ब्लड प्रेशर बढ़ता है, ना कि गुस्सा आता है. It cannot be that high blood pressure is causing gussa. But what it does is, you have to measure it. And if it is high, you need to control it. We know that even at 55, 90% of people who have normal blood pressure will have high blood pressure by the time they are 75. For whom the bells toll, they toll for you. So you have to get it measured periodically. And we can run, but we can't hide. 30% are unaware that they have high blood pressure, 45% are not treated, 70% are not controlled adequately. Because we know that if we reduce blood pressure by 10 by 5 millimeters, we decrease 40% strokes, 16% heart disease, and total cardiovascular events by 20%. So we need to take less salt. We need to do more physical exercise. We need to have ideal body weight. That is the first prescription in anybody who has high blood pressure. What happens if you have excessively fried food? It tends to have more salt. Where is salt? Salt is in every food, but it is your palate. It is my belief that two white substances changed the course of mankind, the history of mankind, and they were not heroin. They were salt and sugar, because man was a hunter. He would kill. He would heat his food, over fire, and cook his food and eat. But when we started making things, and then he started understanding vegetables and fruit, and he would eat them raw. But when we started cooking, we put medium, like we put some fats, we put salt, we put sugar, and that's what got us. But salt, I want you to understand, is also hidden. Baked food, preserved food, has all got salt. So you have to be careful about that salt. Diabetes. What is diabetes? Madhumeh. Madhumeh or diabetes is having excess sugar in the body. Excess glucose. It is defined as fasting plasma glucose of more than 126 milligram per deciliter. There can be type 1 diabetes, which is actually because of lack of insulin, which usually presents in bachas. Or it can be type 2 or maturity onset diabetes, usually associated with some obesity, and where there is double trouble. What is the double trouble? There is relative lack of insulin, and there is a large amount of resistance to this insulin. And even if you are not diabetic, you can have something called a metabolic syndrome, or it is called the metabolic syndrome X, and it is very common in Indians. All those who are a little obese or don't exercise, look at their necks. You might find some skin tags. They are not viral disease. These are markers of insulin resistance. You look at your axilla, your armpits, if it is black, these are markers of insulin resistance. Having abdominal obesity, obesity around your stomach, because when this obesity is around your stomach, it is fat which is around the intestines and in the mesentery. This fat will not allow any insulin to act. So what will happen is insulin levels will go very high in the blood, and thereby the insulin stores will come down. And when they go very high, this insulin also damages the tissue. We cardiologists teach our students that diabetes is a vascular disease. Most diabetics die of heart disease. Most diabetes affects, it's a horrible disease. It can affect every system, every vessel. It can cause heart attacks, it can cause strokes, it can cause kidney failure, and together with other risk factors. An unfortunate tragedy is that risk factors cluster. If a person has got high blood pressure, he may also have diabetes. And when they cluster, they don't have additive effect, they have multiplicative effect. And when we look at our spectrum, by 2025, 3.6 billion people will have diabetes. It has one of the most potent threats. It increases mortality by 3 times, when associated with high blood pressure by 9 times. And this maturity onset diabetes is insidious. You'll never know when it happened. It is silent, it is delayed, and inexorably progressive. Let me tell you, there was a very, very senior person in this country for whom this government spends at least having 10 doctors and other medical staff looking after that person. He was brought to us at one time in diabetic coma. So you can understand that people do not recognize this disease, we do not treat it appropriately, and we do not prevent or retard the complications. Diet, exercise, drugs are all important, but diet and exercise form the cornerstone of its treatment. When people smoke, they think they are having, Devanand had this movie called Hindu. हर फिक्र में धुएं में उड़ाता चला गया. But it is हर फिक्र तो उड़ गई, but 4000 केमिकल आपने अंदर लिए, उसमें से 400 जहरीले केमिकल हैं. It can cause lung cancer, it can cause oral cancer, it is addictive, it can cause heart disease and atherosclerotic disease. It can be atherosclerosis, hardening of arteries, can not only affect the heart, it can affect the brain, you can get a stroke, it can affect the legs, and that will lead to peripheral vascular disease and even gangrene. 30% of Indian males, now it is about 4.5% of Indian females smoke, and 8 lakhs deaths every year because of smoking. 50% of smokers die of smoking related illnesses. One Baba came a few days ago and said, you know, we fixed his arteries, his coronary artery was diseased, his leg artery was diseased, and because we fixed it, he tells me, Doctor Sahab, अब तो ठीक है पर ये सांस नहीं आ रही. So I told him, ताऊ हमारे तो फेफड़े गल गए.